Did you know that heart disease kills more than 1 million people every year, making it the leading cause of death for both men and women? The worst part is that nearly half of heart attacks occur without prior symptoms or warning signs. Hello viewer, and welcome back to Active Health. While some risk factors, such as family history and age, are beyond your control, there are choices you can make to improve your heart health. And that includes knowing what not to do. In today's video, we'll tell you about habits you should avoid if you want a healthy heart. From drinking soda, ignoring your sleep, not flossing, overdoing it with salt to being overweight and much more. Watch until the end to learn about all of them. Drinking alcohol excessively. While a daily glass of red wine has health benefits, excessive alcohol consumption is linked to health problems. Drinking more than 3 drinks per day can have a toxic effect on your heart. It can lead to high blood pressure, an enlarged and weakened heart, and a higher level of fat stored in your body. A good rule of thumb, and for the heart, drink no more than 1 drink per day for women and no more than 2 for men. How many drinks do you have per week?
1? 2?
Let us know quickly below in the comments section. Ignoring your sleep. Snoring can be a sign of sleep apnea, a disorder where your breathing starts and stops during the night. This causes sudden drops in oxygen levels, which raises blood pressure and overworks the heart. If you wake up with a sore throat or your partner reports loud snoring, talk to your doctor. Your sleep time also matters, as research has shown a connection between sleep deprivation and heart problems. Remember to aim for 8 hours per night. Sitting for hours. Regularly sitting for several hours at a stretch can increase the risk of heart attack or stroke, even if you exercise regularly. Research has linked sedentary behavior to obesity, high blood pressure, and a higher likelihood of death from heart disease and cancer. Experts believe that lack of activity affects blood fat and sugar levels. You can combat this risk by moving whenever you can, walking around the office, or even using a standing desk. Overeating. The biggest concern for everyone with overeating tends to be weight gain, or maybe a stomach ache. But filling your plate with second and third helpings can cause much bigger problems. Heavy meals can also trigger heart attacks or heart failure, especially if you're already dealing with a heart problem, such as heart disease. When you eat a lot of food at once, your stomach expands and the body diverts blood from the heart to the digestive system. In people who already have blocked arteries, any diversion of blood from the heart can result in chest pain. Smoking. Most people know that smoking is bad for the lungs. But it's also bad for the heart. Smoking damages the heart by harming blood vessels and raising blood pressure. Plus, it prevents your body from getting enough oxygen in the blood. Even being around others while they smoke can cause serious damage. Stress. Trying to get the kids to the bus stop on time, meeting deadlines at work, or paying an unexpected home repair bill can all be stressors. And if you're constantly feeling the side effects of stress, your body can feel the consequences. This can make your heart rate become irregular. It's also known to cause inflammation in the body. If you're in a constant state of stress, your body is in that unhealthy state all the time and it can cause serious damage to the heart. Not flossing. Your dentist is right. Flossing is important, not just for your teeth. One study found that people with coronary heart disease who flossed had fewer heart problems. What's the connection? Studies show that bacteria associated with gum disease promote inflammation in the body. And inflammation has been linked to a higher risk of heart disease. A variety of flossing tools are available to make the task easier in hard-to-reach areas, from floss picks to guides that direct the floss. Overdoing it with salt. Excess sodium can lead to high blood pressure, a risk factor for heart disease. Avoiding the salt shaker isn't that hard, but what about hidden sodium? Processed foods, including canned vegetables and soups, cold cuts, frozen dinners, chips and other salty snacks, are responsible for most of the salt that people consume. Be sure to read nutrition labels and compare products. Choose the one with the lowest daily percentage value of sodium. A good rule of thumb to follow. Consume less than 1,500 milligrams of sodium per day. Watching too much TV. Many people would probably admit that watching TV is their favorite pastime. But while your brain loves engaging in those Netflix marathons, your heart isn't such a fan. In a 2019 study, researchers found that those who watched more than 4 hours of TV per day had a 50% higher risk of heart disease and premature death than those who watched less than 2 hours per day. So enjoy your favorite show, then move on to a less screen-focused activity. Eating too much red meat. If red meat is on your plate every night of the week, it's time to cut back. This is because there is a correlation between increased red meat consumption and heart disease. The more red meat you eat, the higher your bad cholesterol tends to be. That's why you should eat red meat in moderation, or better yet, avoid it altogether. Ignoring depression. If you know you're depressed but haven't done anything to help regain your mental health, you could be harming your heart. People with depression have a higher risk of heart disease. One study found that providing early treatment for depression and addressing symptoms early reduced the risk of heart disease by half. Be mindful of your mood and seek help early if you notice you're experiencing feelings of depression. Eating too many processed foods. Sure, processed foods are amazing. There's no denying that. Unfortunately, they're terrible for the heart. Fried foods, processed cheeses, snacks and junk food provide no nutritional benefit and in fact, cause harm. What's the alternative? Following a Mediterranean diet is a good start. It's the best way to lower cholesterol and nourish your body with heart-healthy ingredients like fish, legumes, nuts, olive oil, and fruit. Eating too many processed foods is bad not just for the heart, but it can also make your skin look older. To learn which foods you should avoid, watch the video titled 13 Foods to Avoid If You Want Younger Looking Skin. Now let's get back to daily habits that are bad for your heart. Drinking soda. Soda puts your heart at risk. One study found that those who regularly drank diet soda were more likely to suffer a stroke or heart attack and die from vascular disease. This is even after researchers controlled for factors like smoking, exercise, sodium intake, and high cholesterol. Sugary soda is also potentially harmful. People who consume a lot of added sugar, like that in soda, have a higher risk of dying from cardiovascular disease. Poor diet. You probably already know that sugar, salt, and processed foods can affect your heart health. But sometimes it's what you don't eat that can cause heart problems. If you don't eat fruits, vegetables, whole grains, beans, nuts, fish, and poultry, you could be causing additional harm. Studies have shown that people who eat more fruits and vegetables at each meal have a reduced risk of heart disease. Being overweight. It's true that overweight people have a higher risk of developing heart problems. An even better way to judge if your weight might affect your heart is to measure your waist. People who carry fat in this area tend to develop heart complications more than those who carry it elsewhere. It's recommended that men maintain a waist size of 40 inches or less. Women should aim for 35 inches or less. Getting angry frequently. When you get angry, your body releases stress hormones. This makes your blood pressure rise and your heart rate increase. It also makes the blood more likely to clot, which is especially dangerous if your arteries are narrowed by cholesterol-laden plaques. After a bout of anger, your chances of having a heart attack, stroke, or chest pain slightly increase for the next 2 hours. Keep your anger under control and don't react in the moment. Communicate calmly instead of expressing your anger loudly or violently. Skipping annual physical exams. An annual physical exam is an important part of staying healthy. You should also get blood tests every year. This allows your doctor to better understand your numbers when you're well. With a baseline, your doctor can identify warning signs that your body isn't feeling well. If doctors know you when you're well, they'll be prepared to provide the best care when you're sick. And that can prevent some diseases altogether. Having your blood tests on file can help your doctor quickly and accurately identify a heart problem. While avoiding these habits can give you a healthy heart, it's very important to also recognize the signs of an unhealthy heart, so you can act in time. Learn more about these signs by watching. These 2 videos on the screen will definitely help you identify heart problems early, so you can take preventive measures. So go ahead and pick a video, or watch both for maximum benefits. What is that daily bad habit that is harmful to your heart? Let us know in the comments section below.